All right, we're going to get started before too long. I'm going to give some people just a few more minutes to get rolling, to get on, and then we'll get rolling here. So give them just a few more minutes here. So we're going to give 'em about one more minute, and then we'll get started. Okay, so thank you guys for coming. I hope that you can see and hear everything. So we are going to get ready to get rocking and rolling here. I hope you guys have had a wonderful week this week, and hope you guys have a great weekend. It's a little bit more chilly out there. All right, so let's get rocking and rolling, and then anybody that shows up can just be a little bit late. So today we're going to talk about, we're going to begin really a series of webinars over the next, it'll probably take us about 3 months or so to kind of go through everything. But we're going to hit some of these major topics. And really, we want to start focusing on disease triggers. And there's several triggers. And, when we understand, what is a trigger, it's really something that triggers a change in normal physiology. And so by triggering a change, it stresses the body's ability to adapt to its environment and perform healthy functions. And so if we think about health, that is a very hard definition to really define, because it's not a quantitative it's not really a quantitative thing that you can define, but there's a lot of characteristics of what it is. And so when we think about being healthy, right? I mean, really, a lot of it boils down to your body's ability to adapt to changes in the internal and external environments. And so when we have things that prevent our body's ability to do that, that's when we start to have disease problems. Okay, so with that said, again, we're going to kind of dive in, and this is part one, and we're going to be focused on food and food sensitivities, and we're going to dive into why that is an issue. So for those of you guys who are not familiar with us, I'm Dr. Justin Snyder, and I am a practitioner and part of Pro Health Center. And this is the team of owners that we have with Pro Health Center. And so I practice as a chiropractor, but I am also a board certified chiropractic internist within the chiropractic profession. Currently, I'm working towards a diplomate with anti-aging and functional medicine through the American Medical Association. And currently, I'm actually going through training to be certified in advanced metabolic endocrinology. So I've done a lot of studying, and it's funny because the more you study, the more you don't know. But as we go on through, like I said, I've studied on peptides, I've studied in nutrition, and many other things. But I get the pleasure of working with an integrative nurse practitioner, practitioner Beth Letta, and then my wife and Heather. They also help us. And then we have an awesome team. So for those who are not familiar with us, this is us. And I'm a chiropractic internist. These are, and that's what we call a DABC. And so, these are two of my three children, and these are kind of the reasons why I was motivated to get into this aspect of our field in within the chiropractic profession, and why I've taken such a huge interest in functional medicine, because both of my children have a autoimmune problem that is very, very rare. And so I had it as a child, but nobody knew what it was. And so that's kind of what drove me down this path, is trying to find answers for my children. So but anyway, those are my children. Enough about me. Let's start getting into what we want to talk tonight about, and that is really about health. And when we think about being health conscious or healthy, we get back to some of that core definition of what is health. It really starts with food. And in order for us to build a foundation of health and healing, it starts with what we put in our body. And so when we think about food, right, food can be harmful, it can be helpful, it can give us energy, it can cause fatigue. There's so many things that food does, but food is our foundation. And so I promise you, you're going to eat at some point in time. And so when we think about that, an overwhelming majority of people eat healthy foods that are actually causing themselves more harm than good. And that's kind of, interesting, because, we're not talking about the nutrition aspects of food. I'm not, and that's one big thing we want to talk tonight about, is when we think about how does food trigger changes in a disease setting, or how is it trigger an abnormal physiology. We're not talking about oh well, spinach and squash and da 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 da, those are healthy foods, and donuts and ice cream and cookies and those things are bad. We're not talking necessarily about blood sugar, right? Those things obviously have an effect. What we want to get into, right, is more in the details than that. Because while sugar does create an inflammatory problem, and sugar will suppress immune function, right? Sugar is a big thing, so we definitely don't want to be eating a lot of sugar. But more than that, we want to understand how foods build us up or tear us down from a foundational approach, okay? And so, when we look at that, we really have to understand that foods that we're putting in, they may actually be driving our fatigue problem, our autoimmune problem, the headache issue or the joint pain. They may actually be a big part of this, and we don't even know it. And so we may be shooting ourselves in the foot. And so food sensitivities, you're starting probably in the last 2 years have started to hear more about food sensitivities, but we've understood that food sensitivities exist for many, many years. And there are, different conditions, medical conditions, that are linked to food sensitivities. But in order to really understand food sensitivities and how food can be setting up a disease trigger, we need to understand what really a food sensitivity is. And so most people are familiar with food allergies, right, and allergic responses, right? Most people are familiar with that. And what we're going to be talking about tonight is not, we're not talking about food allergies. And a food allergy, when we think about somebody having a peanut allergy or a shellfish allergy or a nut allergy, we're talking about people that have an immune response that is allergic in nature, and we're going to dive into how that's different. Food sensitivities, on the other hand, are harder to identify. If somebody has a peanut allergy, they eat a peanut and within 30 minutes they know it, right? Even if they don't eat a peanut, if it's an anaphylaxis type reaction, they can just be in the same room in some cases and have reactions. So, it's very easy to identify an allergic reaction, but a food sensitivity is not the same thing. Food sensitivities are much more difficult to identify, and they are what's called a delayed hypersensitivity or delayed response. And so what can happen is the response, the inflammation, the problems that come from food sensitivities can take up to 72 hours after the exposure to actually come to its peak, okay? Whether that be inflammation or some kind of symptom from this, it can actually take up to about 72 hours for this thing to actually kick off into its peak, okay? Whereas, like I said, an allergic response, 30 minutes, you know it. Food sensitivities are going to be much quicker, okay? So food allergy versus food sensitivity. An allergy, it's not the same thing. An allergy is an immediate reaction. And really what triggers it is having an immunoglobulin E or an IgE reactivity, okay? Now within the immune system, we have things called immunoglobulins, and immunoglobulins help our body to have memory. It helps us to make antibodies so that if we ever get exposed to something, we can always, remember it, or we recognize it, okay? So the immunoglobulin E is it's very reactive in that it will stimulate a histamine response. And so that's why we tend to see it with food allergies. When we're talking about food sensitivities, it's more of an IgG and an IgA response. Now, understanding this, we have 5 different types of immunoglobulins. IgG is the most abundant type of immunoglobulin. And it is more based off of cytokines and interleukins, which basically are just chemicals that the immune system uses to trigger responses and to react, okay? IgAs are immunoglobulins that line mucus secreting membranes. So in IgA, you're going to find that lining the nasal passage, the sinuses in the head, the GI tract, okay? IgAs are kind of our body's first line of defense. And so if we start making IgG or IgA antibodies, right, immunoglobulins towards these foods, then we can start to create a problem, okay? And so because of this and because of the nature of how these things respond when we have a immunoglobulin reaction, or antibody reaction, what we tend to see is that it's a little bit more delayed, okay? And so that can start pushing the body to an inflammatory pathway, and it can start pushing an imbalance in the immune system. So just to kind of recap, right? Food sensitivities are slow. They do not happen immediately. If you're severely reactive to a food, you could have a food sensitivity that may show symptoms within an hour or so, and sometimes a little bit quicker, but typically you're looking at an inflammatory response that will peak at about 72 hours, okay? And it's going to be an inflammatory response, which is going to affect multiple tissues in the body, because you're going to see that become more systemic. How that presents in each person may be slightly different. Whereas in an allergy, we're talking about airways, you're talking about skin, you can have hives and whelps and things of that nature. And you can have swelling, itching of the eyes, runny eyes, runny nose, some of those things. So again, a little bit different. And so when we focus on food sensitivities, these are different conditions that have been linked to food sensitivities. Okay. And so chronic fatigue, intestinal disruption, infections, brain fog, bloating. You can have memory issues. We see migraines pretty common when we have somebody that has pretty severe reactivities to foods. Sometimes it can even be a driving factor in some diabetics. Pain and inflammation. Definitely with joints, hemorrhoids, um, anxiety is a big one with foods. Okay, mood changes are big ones with foods. Like I said, you can drive autoimmune problems, right, with food sensitivities. And I'm not saying that food sensitivities is the cause of the autoimmune problem, but it will definitely push it harder, push that pathway harder, all right, and even up to fibromyalgia. So there's a lot of medical conditions that have been linked with foods and food sensitivities. And so when we, as we go through this process, we just want to understand that, it's not a one size fits all. And I can tell you, I've seen many different cases that have improved with food sensitivities. And just to give you some examples of some personal cases, I've had patients with shoulder pain, chronic shoulder pain for 7 years, and come to find out it had a lot of relativity to food sensitivities. And as a matter of fact, once that patient actually cut out their food sensitivities because they were pretty severely reactive to 2 or 3 major foods that they had as a staple in their diet. Once they cut that out, the shoulder pain was significantly better. And I've seen patients with migraines that are throwing up, vomiting, and having basically out of commission spells for 2 or 3 days. And again, I mean, once we ran the food sensitivity test, for her it was milk and dairy, and so it would put her out. And so I mean, I've seen skin issues, I've seen headaches, I've seen shoulder pains, I've seen knee pains, I've seen sinus problems and chronic sinusitis. I've seen a lot of those things. And again, just different cases and things that we have seen from food sensitivities. So understanding kind of food sensitivity, and how do we get food sensitivities, and what really is, how does this whole thing work? Well, in a healthy person, when we chew up our food, we digest our food, and we have several different enzymes that are stimulated. And whether it be from the saliva or the gastric secretions, the pancreas, but we've got several enzymes, and these things, their whole purpose is to break down foods. Okay. Now the immune system is it's constantly looking for things in the bloodstream and things in the GI tract that are not good. Okay, and that could be viruses, could be bacteria, could be parasites. But it's always on the lookout for things that are going to harm us. And so one of the big ways that the immune system works is through proteins. And proteins can be good, they can be bad, and they can, in a sense, be neutral. But proteins are kind of how the white blood cells communicate and recognize things. It's protein structures of things. And so if we have undigested proteins, if our digestive system is not functioning well, we can actually have increased amounts of proteins in our GI tract that can start to create some reactivity. So some food sensitivities can simply be created just because we have a GI dysfunction. Okay. And so that can absolutely occur. So when we think about GI function, right, the stomach acid, right, a big part of stomach acid is to break down protein. Okay. And so in that gastric juice within the stomach, we want to break down our proteins, and we ideally want to break those down into peptides and amino acids. Okay. And so, once the food gets from the stomach down into the intestines, the white blood cells are in the base membrane of the intestinal lining, and so they're kind of in there, and those IgAs are constantly checking for good guys and bad guys. And so we know what probiotics are, and some of you may have heard of what prebiotics are, which is basically just food and nutrients for the good bacteria. But we want to make sure that we have a good functioning what's called microbiome. Okay. And so when we have digestive dysfunction, when we don't digest our food well, or when we constantly put things in, we start to affect the health of our intestines. Okay. And so when we actually look at the gut and the small intestinal lining, we know that the gut has nerve endings within that lining. And so we know that it makes what we call our second brain up. Okay. So we have direct neurological connection from our gut to our brain. All right. And as a matter of fact, in more recent traumatic brain injury research, when we looked at CTE in some of the professional sports, and we looked at traumatic brain injuries and PTSD and some of these things, what we've actually identified is that what affects the brain will affect the gut, and what affects the gut will affect the brain. So what they found is within 3 hours after a post-traumatic injury, brain injury, like a concussion, you will have a GI dysfunction. You will start to see changes in the gut because we've had damage and inflammation in the brain, and so it will start to affect the gut. And then again, vice versa. If we start creating an inflammatory response in the gut, that's going to affect the nerve impulses back to the brain. And so we can see this inflammatory process start to affect neurological function. And that's kind of how we see a lot of, headaches, brain fog, memory, just speed of which you can process. All of those things, kind of are really, in a sense, driven from these food sensitivities. So when we think about that, the other thing is what the literature shows is about 70% of our immune system is really found in our guts. And so the good bacteria are really, in essence, what is keeping us in a good, healthy place. And so, microbiome, and you're going to hear me say it a couple times throughout the night, but our microbiome, which is, again, just our concentration of good bacteria that or bacteria that make up our gut flora, what we need is very, very important in controlling many different things. Okay, and so one of those is the immune system. So here's the crazy thing: based off of the health and the function of the gut, and based off of our microbiome, it will have also a tremendous impact on our endocrine system. If somebody has, and especially with yeast love sugar, right? And so, just something you will tend to see is people that crave sugar and crave sugary foods and crave starches, sometimes it's actually really becoming because we've got a yeast infection going on in our gut. And so it's kind of crazy how those little guys, man, they can really drive our sugar cravings. Now, again, the brain and when we think about neurotransmitters and some of these other things, those can also create some sugar cravings. But fungal infections in the gut can drive sugar cravings, can drive brain fog and depression and some of those things. So we just tend to see those link up. So we definitely want to make sure that our gut is in a happy place, because the nervous system, our brain, our immune system, and our endocrine system, those are the three main systems that really run the body. And if our gut's not happy, it's affecting all three things. Okay. And so when we look at the small intestine, you'll see this picture here. Our small intestine has a bunch of little cells that line the intestine. Okay. And so we call them intestinal villi. More importantly, the cells, when we look at them, are called enterocytes. And you'll notice that there's little gaps in between these cells. And these cells are held together in channeling mechanisms, and they're designed to only allow the good stuff in. That good stuff being like minerals and vitamins, some of the fatty chains, some of the smaller proteins and amino acids, things of that nature. If this lining starts to break down, we lose our layer of protection. And when we lose our layer of protection, we start seeing things like bacteria and viruses, funguses, even toxins. Things start getting absorbed through the gut lining into our bloodstream that are not supposed to be there. And so when we see that, we call that, in layman's terms, a leaky gut, right? And some of you may have heard the term leaky gut. The reality is in the medical world, we really call that hyperpermeability. It's not really known as leaky gut, but it's been kind of coined in layman's terms as leaky gut. But leaky gut starts to create a whole host of problems, and we've kind of already hit that. And so this kind of gives you another example of leaky gut and how this kind of responds, or how it works. So when we have these potentially undigested foods, they get into our gut. Other things can cause this breakdown. It doesn't just have to be undigested food. It could be coming from a lot of sugar, which then can alter your good bacteria versus your bad. It could be coming from chronic use of antibiotics, right? If we don't put the good stuff in, antibiotics tend to kill some of the bad things. And some of they kill our bad guys, but they can also kill our good guys. And so if we have a lot of antibiotic usage, we can ultimately disrupt the microbiome, our flora, and we can start to create a problem there. And so other things that can do this are things like gluten proteins, pesticides. Sometimes a lot of dairy for some people will do that. There are different chemicals that we're exposed to. And so, but what happens is if we start to lose the health of our cells and lose the good bacteria that keep our cells healthy, right, that they work in tandem with each other, we start getting these cellular breakdowns. And that's when we start getting things that get into the bloodstream, and they get through something called the GALT, which is the gut associated lymphoid tissue. And so we start creating this inflammatory response. We can start seeing these food intolerances. We can start pushing autoimmune pathways, because we start stimulating the immune system in one specific way consistently over and over again. We can start creating problems with malabsorption, so we can't absorb things that we need, okay? And so we start to really just completely break down our gut function. And again, if we have this inflammatory process in the gut, it's going to affect our brain, and eventually it could affect our blood-brain barrier, and then we could start to see an inflammatory response in the brain. So, you'll hear a lot of people talk about gluten, and, if you read some of the articles out there, some say, well, a gluten-free diet's not really any more beneficial than a non-gluten-free diet. And, to a degree, that may be true for some people. But, we're not talking about celiac, right? We're talking about non-celiac gluten sensitivity. And, there are other articles that will talk about, eating gluten increases risk for different disease processes. So it's not just gluten, though. And that's the key that I want you guys to really understand is that there's more to this process than just gluten-free, dairy-free, egg-free, right? It's more to it. We want to understand that. Remember, the majority of the immune system is found in the gut. Some neurotransmitters like serotonin, which has a lot to do with depression, those guys are going to be found in, made a lot in the gut, and interactions are going to be in the gut and that immune system. So again, when we think about food sensitivities, right? Food sensitivities set our bodies up to have a problem, right? And so if the GI system is dysfunctional, it's going to drive food sensitivities. Now, I'm going to take you back one more slide here before we get into some of these numbers, because here's one of the things I want to just hit on briefly here, and that is, we talk about the delayed response of foods. Okay, if you think about how many different foods you eat over a 3-day period, how hard would it be to identify just one thing? And that includes your oils, all your spices, right? Those kind of things. There, most people are going to have a lot. And because this thing is a reactive process that is slow, it makes it very hard. So you hear people talk about elimination diets, and that is extremely hard to do. And I'm not saying that there may not be a time and a place for it, but it's a lot easier to draw somebody's blood and measure the reactivity of each protein. Okay. And so when we think about food sensitivities, another thing that I want to hit on is, again, like I said earlier, it's not about the nutrition aspects. Okay. It's not, well, this, spinach is high in, B vitamins, or high in iron, or, calcium, or it's not that. We're not talking about the nutritional aspects of these foods. We're talking about, does the food create an inflammatory response in your body? Because if it is, while it may be high in B12, it may not be the best food to get your B12 from, right? Because it's creating a problem. It's stimulating the immune system. Think about this. Why would something like this cause a chronic fatigue or a headache? Well, guess what? When you get an infection, a lot of times you'll get a headache. Why? Because infections cause a lot of inflammation. And we're going to talk about that in our next one. But, infections cause inflammation. Well, what if a food is doing the same kind of thing? You're getting the same kind of response. And so, again, when that occurs, it's going to wreak havoc on your body. So it's not that, hey, spinach is bad. It's just there may be other forms of vegetables that would actually improve you versus just providing you nutrients. And that's why we talk about food is, really our foundation. Okay, we want to build from it. So give you an example. When we look at cartilage, for instance, in the knee, the cartilage in the knee is, got a similar, collagen structure to dairy, but understand this. If somebody has, let's say let's say that they do a lot of physical work and their knees take a beating. And so we get an inflammatory response. And then let's say they start taking ibuprofen, okay? Because we know that ibuprofen and repetitive usage, or chronic usage of ibuprofen will cause damage to the intestinal lining. And so if we're constantly taking ibuprofen, we can actually be disrupting our gut health. And now we start absorbing these bacteria or food sensitivities. We start creating an inflammatory response. And the next thing you know, we've got more inflammation in the knee, which means we have more pain in the knee. And so what do we tend to do? Well, we tend to, a lot of times you'll see people take even more ibuprofen. In that case, we didn't really help that person get healthier, because we're just trying to negate the pain, when some of that pain, or a majority of that pain, could just be a process of inflammation. And part of that, or a majority of that, could actually stem from a gut dysfunction. So again, food sensitivities, I can tell you my highest food sensitivity is squash. I've seen patients with, spinach and chicken, different fruits, vegetables. I mean, I've seen, gluten, dairy, and eggs. Everybody's unique. And I've seen a lot of food sensitivity tests since I've become educated about food sensitivities, and I've started running food sensitivities 7 years ago. And I can tell you, not everybody's the same. Now, here's a neat little fact. We talk about IgG food sensitivities. IgG food sensitivities, the immunoglobulin G is the only immunoglobulin that can be passed through the placenta. So sometimes, babies can actually have some of that reactivity, immunity to certain foods because mom. It doesn't always happen, but it can happen, right? It's the only one that has passed. So when we think about food sensitivities, you really have to understand that while foods drive inflammation when we have a reactivity, they also are contributing to a gut dysfunction. And gut dysfunction creates even more disruption to the immune function and the endocrine system and, neurologically. And so we start setting ourselves up for a physiology or a body that doesn't work right. It doesn't work well. And that's because we're insulting it. If you took a cheese grater to your arm and rubbed it on your arm every day, it wouldn't take you long before your arms would just be nasty and scarred up. Well, I'm not saying, I mean, that's a little bit more of a pretty rough explanation, but when we put things in our guts that are damaging to the gut, right? Even if it's ibuprofen or a lot of milk or sugar, that you're inflaming the gut. You wouldn't want to keep that cheese grater running up and down your arm. So why would you keep putting some of these things into your body? Same thing goes with food sensitivities and some of these things that drive GI dysfunction. So, sometimes it's what came first, the chicken or the egg. Was it the food sensitivity that kind of set things up? Or was it other factors that set up food sensitivities and now we're just on this vicious cycle, right? So when we think about, health conditions, look at cancer, heart disease, right? Metabolic syndrome. Here's the crazy thing. Right now we're really very focused on COVID-19, and understandably, it's new. We don't really know much about it, but we do know that the people that are dying from it are not healthy, and they're usually older, right? And unfortunately, most older people aren't healthy, and so they kind of go hand in hand. So when we think about, looking at triggers of disease processes and talking about how do we kind of improve our health, but stop these things that drive an abnormal physiology and abnormal functions in our body, we've got to make sure that our gut health is taken care of, okay? Because it is a major cost to get some of these other diseases. Not to mention that cancer and heart disease are the top two causes of death in the country. And while we're worried about the 38,000 from deaths now from COVID, I believe somewhere in there when they CDC just changed the numbers, it was in the 60s, but they came back and changed those numbers, right? But when we think about that, I mean, that is nothing compared to the cancer and heart disease, heart attack deaths. I mean, there's way more of that, right? And so, understandably, we've got to get healthier. But what the CDC says is that 83% of degenerative diseases are preventable. And that is because we know that 83% of these degenerative diseases are driven through lifestyle, diet, and exercise. Part of that, though, we can eat a healthy diet, but if you don't know what foods are causing an inflammatory response, how are you going to be healthy? It's going to be very difficult for that. So we've got to make sure that in order to help not only the gut health, that we're taking care of ourselves by knowing what foods are going to drive an inflammatory process and what foods are going to drive more of a healthy response, something we can build on, okay? So we think about that, our slogan at ProHealth is, do you want to be healed from John 5:6? And so, that is the thing is you have to ask, the Lord spoke to me with this one because it's really the epitome of what we stand for at ProHealth Center. You have to ask yourself that question when you start on this journey. Do you want to be healed? Because if it's really a simple answer, yes or no. If you do, then you're going to do the things that you need to do to be healthy. And I'm gonna tell you, I hear it all the time. Some patients will say, "Oh, I need the test. I need to get a food sensitivity test, but I don't want it because it's gonna say that I don't need to eat something I want to eat or I like to eat." And it's like, well, then you must not really want to be healthy, right? Or I'll have patients say, they'll get their results and they're like, what am I going to eat? Well, there's plenty of other foods there. You just may not be that kind of familiar or common with them, or, you're going to have to find a new, favorite, right? But if you want to be healed, if you want to be healthy, one of the big things you have to do is build the foundation of health, right? And that starts with what you put in your mouth. And you got to identify, is what I'm putting in my mouth going to cause an inflammatory response and promote disease processes? Is it going to promote a broken physiology, or is it going to support a healing and repaired process, right? So do you want to be healed? When we run these food sensitivity tests, it is a blood test. Okay, it's not a hair analysis, it's none of those things. It is a blood test. It's one tube. When we do a venous puncture, ideally that's better. You can do it from a finger stick, but I'm gonna tell you, you've got to milk a cow basically to get enough blood from a finger stick uh, to actually have enough blood to really get a good result. So we have run finger sticks on like kids, and I'm just going to tell you, sometimes it's a whole lot quicker and simple and easy. While you may have to hold the kid down for a blood draw, here's the deal. It's done a whole lot faster than if you stick them in the finger and you've got to constantly squeeze that finger over and over and over to get a blood sample on one of those blood collection cards. And even then, sometimes it'll clot, and then you got to stick them again. So, ideally, we run the blood draw, and we usually recommend the food sensitivities for patients, people at least 2 years of age and older. From that first 2 years of life, the immune system's really trying to develop, and really at the age of 2, you're still trying to kind of develop an immune response. So a lot of times I will say, maybe push them till more of 4 or 5 years of age. But there are some times that, we would say, hey, you probably need to, maybe get it done. But all the way up. And, honestly, when we look at our tests, we can either test a list of 96 foods, or we can do 184. And I almost always recommend 184 foods, unless it's a kid, like a small child. But the reason being is because, when we look at food sensitivities, gluten, dairy, and eggs are probably 3 of the most common. I've seen very few people, maybe on 2 hands I can count them, that didn't have at least one of those 3. Okay, but here's the deal: if you have a gluten sensitivity and you start using gluten substitutes, if you didn't test for those substitutes, then you're not going to know. Or you may be doing as much harm or more harm because you're eating a specific substitute. So the 96 panel does not have all of the substitutes for different things. And so again, usually I say, look at the 184 foods. That gives you a tremendous amount of insight. And our standard test is the IgG. Okay, IgGs make up about 70 to 80% of your immunoglobulins. IgAs will typically make up about 10 to 15%. And then you've got your IgM and your IgE and your IgD, and those are much less, as far as the concentration. So IgG is the most common. Now remember, this is not I had a allergy test done at the allergist and they pricked me in the back with a bunch of things and I'm allergic to, oak trees and pollen and da 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 da. This is not that same test. That is an IgE response, right? That they are measuring. That is an allergic reaction. This is an IgG sensitivity, hyperreactivity, hypersensitivity response. Okay. And so it's a completely different pathway. It's completely different. So we almost always recommend the 184 foods. Our IgG is our standard. There are times when we will look at an IgA. If somebody has an autoimmune problem, remember the IgAs are going to line the mucus secreting membranes, right? So they're going to line the mucus secreting membrane. So if somebody has a chronic sinus infections, chronic sinusitis, a lot of allergy issues, we will probably look at that. If somebody is in an immunocompromised state, we obviously want to look at that. So definitely some things that we would look at, as far as that goes. So when we think about the IgG, IgA food sensitivities, here's the deal. for our webinar listeners, we're going to give you an opportunity to save $50 off the test. Okay. And that's for the rest of this month. If you would like to get a test, we can always sit down with you guys and kind of determine which test would be the best one for your specific case. Like I said, I don't recommend both of them for all of them for everybody. And typically a kid would be a 96 panel versus the 184. It just depends on the situation. And so the different panels, it's different prices, okay? And the prices can range really anywhere from about $250 up to in the upwards of almost $700. It just depends on what you are testing for, how much you're testing. And so, those guys, those guys are definitely going to be very dependent on the case, okay? So let's see here. Understand with this, when we work with patients, I will tell you this. We always, we do, and I just kind of hit on this. Not everybody, it's not right for everybody. There's no point in spending money on the food sensitivity test, and really any test for that matter, if you're not willing to actually make the change. If you're not going to follow it, it's really, don't spend the money on it. I mean, it's not going to work if you don't spend the money. And I can tell you from my personal experience, practitioner Letta would tell you the same thing. When people follow the test, they see a great result, right? And they can see a change in their health. And it's probably one of the tests that gives us one of the greatest returns as far as results, right? But again, it only counts when you follow it. You can't, and remember, it takes 72 hours for this reaction to peak, and it can take up to 5 to 7 days for you to completely get over this whole reaction. So if you go, well, I didn't eat it for 3 days, so I'm going to splurge and have it today. Well, guess what? You never even got out of that whole reaction. That process lasted almost a week, and you restarted the clock at 3 days in. So again, when we think about trying to get out of this inflammatory response, you got to have at least a week, but you've got to constantly stay on point with the food sensitivities. And that's why we say it's not for everybody. You got to want to be healed. You got to want to be healthy in order to get the result. Unfortunately, there's no other way when we think about food sensitivities. You just have to eliminate it from your diet, right? And help your body to heal and help your body not to be hyperreactive. So with that being said, if you guys would like to do some on-site or virtual consulting, we are here. We're here to help you. One of the things that we did do tonight is we said if you shared our post that we would enter you in for a drawing for 50% off our food sensitivity tests, right? And so that's what we're going to do. So I'm going to go ahead and we're going to draw a name, and so you guys will know. So we're going to shake it up here. I've got my 3-year-old here in his Darth Vader costume. He's going to be the one that draws it for us. Thank you. Okay. All right. Thank you, sir. All right. We got Welchel. So you can give us a call and set that up if that is something that you are wanting to do. So that's a great opportunity. Okay. So thank you guys so much for being here. Let's kind of hit on this. We're going to be we'll be sending out an email, and we will be sending out a link for our upcoming part 2 of the disease triggers. We're going to be talking about chronic infections and infections in that one, and that's going to be a 2-part series. So that is going to be coming out probably next week as far as the registration. So if you guys want to get registered, be looking for that. I believe Katie said Monday. Yep. So email will go out Monday. We've already been working on this. We've had a little bit of an issue with trying to get things set up and squared away. But I think we got all those bugs worked out. So Monday we should be sending out a link for that. And like I said, it's going to be on chronic infections and how infections trigger certain disease processes. And we're going to talk about different links of different infections and infectious agents and disease pathways and stuff. So that's going to be a really good one. We're going to hit on some things with Lyme and Hashimoto's and thyroid problems and some of those things. And like I said, that will be a two-part series. So please, if you guys are getting information out of this, if you like this, please share our post. Please share the registration emails. Check your emails, because we are emailing with our Facebook and our list. So if you guys are not getting that, please make sure that you guys get us the appropriate email, and that way we can make sure that you guys are getting these links. So again, we will be sending that link out on Monday. Please share it, and if you have people that you know that either have the problem or may be interested, yeah, we will do that. So again, congratulations to Miss Welchel on winning the food sensitivity gift. And then again, for everybody that is on here tonight, with the rest of the month of May, we're giving you $50 off of your food sensitivity test. If you haven't had one, call us and we'll get you scheduled, and then we can go from there. So hopefully you guys had a blessed evening. I hope you got something out of it. If you have any questions, please feel free to either give us a call or shoot us an email. You've got our website, our phone number, and then our Facebook page there. And we will look forward to seeing you next time. I hope you have a blessed evening and a blessed weekend, and we will see you then.